Hey guys, today I'm going to go over evaluation management of adolescents. Um, a lot of it is definitions, so I'm not going to spend a lot of time looking at and talking from the slide. I'm going to tell you that you have to memorize it. Some of the stuff that needs to be memorized you've had in advanced assessment last year. Real important. The boards love to ask questions on growth and development. So adolescents are a challenge. You will be taking care of adolescents. Know that they think and process information differently than adults. Adolescents have different health needs than adults, and adolescents have specific health maintenance and anticipatory guidance, which I'm going to talk to you about today. Okay, so phases of adolescent development, which you really need to know. Early adolescence, ages 12 to 14. They're concerned with being normal. They lack impulse control. They're very preoccupied with body image, and they're concrete thinkers. Middle adolescence, ages 14 to 17, there's a lot of parental conflict. There's superficial daredevils. They want to experiment. There's short-lived relationship, and really their peer group defines their behavior. And I think as a provider with adolescents, you have two people to connect with. One is the parent and one is the adolescent. Remember, parents are concerned, especially middle adolescents between 14 and 17. So the challenge is, you're not going to jeopardize any HIPAA, but at the same time, parents are concerned, especially if they're going through this parental conflict too, and that you want to involve them and encourage them, especially if they're being good parents, that they're doing a good job. Later adolescents, even though their adolescents do not think so. So remember that the parents are having challenges too, especially if their peer group is not good and they're trying to, set limits with the adolescents. Late adolescents, ages 18 to 21, relationship shifts to individuals. They're less self-centered, independent from family. They begin to think abstractly, future plans. They have goals, consequences of behavior, and they're very idealistic. I think late adolescents, you find that shift from middle adolescence to late adolescence oftentimes when they go off to college. Developmental stages of adolescence. The role is identity versus role confusions. Erickson's stages, which you need to know for the boards. So in adolescence, developmental stage is identity versus role confusion. Key behaviors of adolescents are they struggle with independence, they're rebellious, they're narcissistic, they think they're invincible. Common fears of adolescence is not fitting in with peers, not like the fruit, and failure. They're afraid of failure. So you really have to connect with them based on their fears. Fears are going to drive them to do things, most likely, if they don't have a good connection at home, that they normally wouldn't do. Age-appropriate approach. As a provider, you want to recognize participation and care, get them involved. You want to answer questions honestly. They need to trust you. Use correct terminology, and that's oftentimes will require some reading of some articles. History, subjective data collection, direct questions to adolescents. Gather information both with parent present and alone. Remember, you don't want to kick out the parent. You want to say it nicely. And if they're a parent that is reasonable, they'll understand that they don't want to be in the room, but include them so that you can get some information from them as well. Physical exam, head-to-toe exam, explain process. Parent usually leaves exam room. So if you're going to begin the exam, the parent's there, you want to let them know that I'm going to ask a bunch of questions with you there, and then I'm going to ask you to leave. So they understand how this exam's going to go. With the adolescents, confidentiality, you need to reassure that certain information will be kept confidential, even from parents, unless there's a serious risk to the adolescent's health. Confidential topics include contraception and pregnancy management, STD testing and treatment, substance abuse treatment, abuse, remember that you're a mandated reporter, mental illness, suicide, or homicide risk. Now, remember, you let them know that if that's the case, then you will be required to report that, and that's when confidentiality will be broken. Remember, when we talk about suicide, there's such a high suicide risk for adolescents. So remember, you always want to shoot and be much more, you want to be hypervigilant about adolescents that are depressed or potentially suicide risk, and let the professionals decide, refer and get a second opinion. This is not your expertise, but a lot of you are nurses and you're good at it. Know when, think about, some of you have kids, some of you don't have kids. We've all had family members that suffer from depression, and sometimes there are no signs and symptoms for suicide ideation except for behavior that is not normal for adolescents. So remember that and get a referral and advocate that this is a sign of strength to get help, not weakness. There is such stigma on mental health that's creating much more deaths in the U.S. right now. So as providers, we have to advocate that getting help and talking about the problems is really a sign of strength. Subjective data, you want to get the past medical history, any changes since last visit, any resolved conditions. The social history is really important as well. Family history, we all know, cardiac, respiratory, thyroid, all of those. Take a good history. Any people dying before the age of 50, any overdoses in their family, any suicide attempts. A lot of times patients aren't going to disclose this information. Immunization record up to date, catch up on vaccines needed. I uploaded the new vaccination schedule, which I know you guys did last semester, pretty sure. I will not ask you any questions on immunizations, but know that you would have to refer to that if you had an adolescent to make sure they were up to date. Medications, names, dosages, indications. Adolescents should know what they are taking and why. Okay, they're not babies anymore. If they want to be treated like an independent person that they want, they need to know their medications and why they're taking it. Any allergies, nutrition and appetite are really a big learning point as a provider. What's their current diet? Is it well balanced? Is there any junk food, beverages, restrictions? 24-hour diet recall is helpful to really understand. You can ask them to write it down and bring it back, or just speak to them about it. Changes in appetite, excessive weight loss or gain are red flags. Body image, we might want to talk a little bit about that with them. And remember, males have body image issues as well as females. Dental health, tooth brushing routine. Do they brush their teeth? Are they planning to have their wisdom teeth? When was their last dental exam? When was their last orthodontic? And then sleep hygiene. What time do they go to bed? How many hours of sleep? And then we're going to talk about head DAS assessment, which is mnemonic for an assessment for the adolescents, and then a good review of systems. This is a mnemonic. It's a systematic way to gather data using established systematic approach. It includes emotional, psychosocial, and risk factor assessment, and can be tailored based on age group and maturity. Remember, you want to interview adolescents with and without parent present to obtain accurate information. This head-ass mnemonic is designed to be conversational with open-ended questions. So home is the first part of the mnemonic. Family unit, who lives at home, describe the community, relationships, how does everyone get along at home, communication style, how are you disciplined, what are the rules, and what are the expectations at home. Concerns for safety, any violence, substance abuse, neglect, Um, and are they stable at home? Um, and if the stories that you hear based, and you will hear some horrific stories, get the resources they need. You know what I mean? Advocate for this adolescent. He might have two parents that are drug addicts, or substance misusers. We're not supposed to use the word addict anymore. Being clean, it's substance misuse and recovery, if you will. Because drug addict and being clean are associated with stigmatizing terms. But if that's the case, these kids need help. You know, they've probably seen some horrific things. And as a provider, you want to have good resources to help you, to help your patients in your practice. Catholic Charities, again, is really wonderful. You can ask them, you know, you have X, Y, and Z. Is there any, you know, especially if they don't have any money, they will do free therapy. But I think an adolescent that's not struggling with drugs, they might even stretch a little more and find something for them. Remember, just getting them involved in some really good clubs or community service will help them feel good about themselves. Education, school, grade school, public, private, are they in boarding, or how are they transported to school? Environment, any safety concerns, bullying, violence, any social factors. And you really want them to tell you about their grades on the last report card. Are they showing up for school, or are they tardy? You know, are they not showing up, which means truancy, and tardiness is, you know, they're coming in late. That's a big one. Employment, job description, hours, income. You want to ask them what type of job, the environment, and how are they getting to work. Are they working full or part-time? Total hours per week. And the shift, the start and end time when they're working. Are they working weekdays, weekends? And does this affect other activities and responsibilities, their work? And if they're working, is it for personal expense or for family support? And how is their money spent? Activities, drugs, and sexual activity. Are they involved in sports, hobbies? How much screen time? Are they watching a lot of TV? Do they have sports and exercise? Are they in organized sports? What is the expectation of them when they play sports? Hobbies, any organized or individual activities? What are their social activities? And if they drive, do they have their license or permit? Do they text and use cell phone while they're driving? That's a big one. Do they follow established law while they're driving? And screen time. Do they use video games, computer, cell phone, texting? How much do they have internet access? And what about social networks? Those are a big one. And I did post an article on a study that was done about media and adolescence. It was very good. And you know, it might be a interesting DMP project to actually develop a website that has appropriate, accurate intervention information, and then do a blog, which potentially could be a nice thing that you know, tell them straight up, but via healthcare provider on you know, sexuality, sexual activity, what's normal, what's not, and what's dangerous. Actually, not what's normal, what's not, but what's dangerous. Sexuality, sexual activity, relationships. Are they formal or casual dating, group or alone, monogamous or multiple partners? Which you got to connect with the adolescent so they feel comfortable telling you. Orientation, straight, bisexual, gay, or lesbian, or ones that are changing gender, which is a whole other way of terminology. If they're transitioning to a female or a male, you have to be comfortable speaking to them in their terms. And again, I did speak to you about pronouns, what pronouns, and then people can actually switch to a female and not have any surgery, and that's considered a social transition versus a surgical transition. And the data in a conference that I recently went to is asking them what pronoun they refer to, and it's considered to be the politically correct way to address those who are transitioning. These patients, as I've been working over at Medically Clearing at South Coast Behavioral Health, they have an adolescent unit there, and I can tell you I've seen over 10 adolescents who are transitioning to different genders, and they are all have SI. And again, I've been speaking in those terminologies because I feel like I'm not well versed in it, but again, I used that, what pronoun would you like to be referred to? And they didn't even stop. They were like, she or a he, or they felt comfortable that I knew the terminology. Contraception and STD prevention, types and consistency, usage, screening test, past current pregnancy or STD treatment. There's a lot of adolescents that they have access to the internet. They are experimenting sexually and they have no idea. They're almost borderline, a lot of them, with sexual addiction, and then they're actually transitioning into different genders as well. So having a healthcare provider to actually normalize and tell them the dangers of prostitution at an adolescent age, which we do see, I see a lot of that. And, not to be judgmental, but to let them know, a lot of these individuals that are having multiple sexual partners are also struggling with substance misuse as well. So, they are less inhibited, and then they're doing things they normally wouldn't do. And you as a healthcare provider, in a non-judgmental way, can develop a trusting relationship where they know that they can, if they're hurting and they're willing to get help, they'll come to you. Suicide, depression, and stress. Suicide or self-harm. Suicide attempts or ideations, cutting or other self-injurious behaviors. Depression, anxiety, feelings of depression or anxiety. Make sure they have treatment and that the management is good. Stress management, feeling out of control, stress, teaching them management techniques, aggression or combative behaviors. Also that there are anger management groups that you could actually refer them to. Is there other mental health history in their self, their family members, or friends? You want to evaluate their self-esteem. How to build up their self-esteem is getting them involved in something that makes them feel good and worthy. Also, safety issue, automobile, seatbelt use, pedestrian safety. Do they wear a helmet when they ride their bike? Sports, you want to check equipment, helmet use, mouth guards, and so forth. Personal sunscreen, water safety, fire safety, gun safety are real important things to review with them. Violence or abuse, personal and peers. Are they witnessing their peers with any violence or abuse? Is there emotional, physical, verbal, or sexual abuse in their lives? Physical exam, normal. It varies with age and pubertal status. Vital signs are heart rate is from 60 to 100, respiratory 12 to 20, blood pressure ranges systolic 100 to 120, and diastolic 70 to 90. 90, you want to look at the chart of what a normal BMI should be for someone of their height and weight. Growth patterns during puberty. You want to make sure that that for their age, they're maturing normally at their age. And remember that if they're not maturing, meaning they're not at the certain height or weight that they need to be, that this could be due to a thyroid, an adrenal androgen problem. And so it's really important that you document that they are within what they need to be or they're not within, and then you refer out to an endocrinologist for further evaluation. So adolescents, they initially have an increase in leg growth followed by trunk growth. Females from 10 to 14, they have a weight gain of 35 to 45 pounds and a height gain of 8 to 10 inches. Males from 12 to 16, they have a weight gain of 45 to 55 pounds and a height gain from 10 to 12 inches. It's quite the growth. You want a log percentile for growth chart. Physical exam, height, weight, BMI, vital signs, the Snellen chart for visual acuity. HEENT, do a full head, eyes, ears, nose, throat assessment. As you can see, it's incomplete here. Cardiac, any murmurs, lung exam, musculoskeletal, scoliosis screen throughout puberty. GU, we're doing Tanner staging, which will be for females, breasts and genitalia, and males, genitalia. Labs will vary. GU, UA, gonorrhea, chlamydia. If they're sexually active, you can do that via a urine screen and follow the PEP guidelines. Hemoglobin and cholesterol, that necessarily does not need to be drawn, but it's driven by symptoms. As indicated, thyroid, hepatic panel, and CBC. Again, those do not have to be drawn regularly on an adolescent visit, but will be based on if someone's obese. Potentially they could be on medications that could affect their liver function tests, or they're having signs and symptoms of thyroid dysfunction, which you would need to draw TSH to rule out any thyroid dysfunction. If warranted, don't routinely draw a TSH if it's not warranted on exam. Tanner staging, pubic hair, you need to know this, okay? This was giving an advanced health assessment, but you need to know this for exam. They always ask 1 to 2 questions on this. And most likely on your final, you'll have 1 to 2 questions on this as well. Tanner staging, Tanner 1, genitals. I'm not going to go through this. You had this in advanced health assessment. Know that you need to know this for the boards and the final. Breasts, again, I'm not going to go through each one. Just know that you need to know this, okay? Anticipatory guidance and health maintenance, testicular cancer, self-testicular exam starting at the age of 15, self-breast exam as well at the same age. Nutrition, they need to get at least 1,200 and 1,500 milligrams a day. Make sure immunizations are up to date. PAP beginning at age 21 or sooner if sexually active, and follow the new PAP guidelines. Screen for chlamydia and gonorrhea on males and females if they're sexually active. You can do a urine test on individuals that are sexually active, especially adolescents, for gonorrhea and chlamydia. And really, the pap smear before the age of 21 you would only do if they were having signs or symptoms of STDs. Although the rate of HPV infection is high among sexually active adolescents, invasive cervical cancer is very rare in women under the age of 21 because the immune system clears the HPV. When they're below the age of 21. Anticipatory, oh, I didn't talk about nutrition, sorry. Nutrition, food serving guidelines, you want to make sure that they have dairy, red meat at least 2 to 3 times a week. They have good portion sizes. You want to make sure they limit empty calories or junk food. Beverages, you want to limit caffeine intake. Fluid requirements, also like make sure that they have a lot of Gatorade, a lot of fluids if they're in sports and they're very active. Immunizations, by age 15, they should have 3 Hep B vaccines, 2 MMRs, 4 polios, and 1 booster tetanus using the Tdap. If no reliable history of chickenpox, they'll need varicella and meningococcal vaccination if child did not receive it at age 11 and 12. And the Gardasil is really HPV vaccine and flu shot yearly. Injury lap shoulder belts. This is really, really key for adolescents. Make sure that they wear the seatbelt, and you need to talk to them about wearing the seatbelt. Injury prevention for those who ride their motorcycle, a bicycle, ATV, skateboard, and rollerblades. Make sure that they all wear helmets. It's really important. Can prevent a lot of injuries. Smoke detectors, you want to ask them if they have smoke detectors at home. Are they working? Do you notice that, do the adults in their home check their smoke detectors? Are the batteries replaced when they go off, or did they just shut off the smoke detectors? Safe storage, handling, and or removal of firearms. Are there any firearms at home? You'll be surprised what you're going to get on assessments. Protection of UV light, that's sunscreen protection that you need to go over, especially adolescent females who do all that tanning. This is an opportunity to let them know that it's carcinogenic and that there is a rise of melanoma. Abuse and violence at home, school, and social situations. Make sure that you're asking them that. And reassure them that that's not normal behavior if they are experiencing any of that. You want to tell them about depression, signs and symptoms, eating disorders, any bullying, and are they at risk for suicide? They might, if they trust you, disclose a lot of information that is going to require a lot of referrals. Remember that you don't want to lecture if possible. You want to provide stats and examples when possible, which will help back up what you're trying to say. Even any articles, any handouts are very helpful as well. Diet and exercise, you want to review, limit their fat and cholesterol, maintain caloric balance, emphasize grains, fruits, vegetables, calcium for 1,200 to 1,500 milligrams of calcium a day. You want to recommend for adolescents, the American Academy of Pediatricians recommends 30 to 60 minutes of physical activity a day, 20 minutes of moderate to vigorous physical activity 3 days a week. Dental health, you want to make sure that they go to the dentist every 6 months. You want to ask them if they floss, brush with fluoride toothpaste daily, make sure they use mouthpieces for contact sports. You want to make sure that they participate in their health care. Are they responsible for maintaining a healthy lifestyle? You want to encourage them that, they're transitioning to adulthood. Now it's going to be their responsibility to maintain healthy lifestyles. You want to encourage them and or yourself report any concerns promptly. And remember, you are a partner, healthcare as a partnership. Chronic illness management. You will have adolescents that have chronic illness, those with diabetes, and remember, you're going to be doing a lot of teaching with them. It's tough to have diabetes as an adolescent. Remember, you're going to be working with mom as well, mom or dad, and encourage any good behavior in any patient that has chronic illness management, realizing that having a chronic illness as an adolescent is very stressful. Physical risk factors for adolescents are substance abuse, sexual promiscuity, mental illness, suicide attempts, self-harm, negative peer influences, low self-esteem, and eating disorders. The majority of adolescent and young adult deaths are due to preventable causes. Young adults have 5 times the mortality rate than younger adolescents. Motor vehicle accidents are one of the leading causes of death for adolescents and young adults, and the other is opiate overdoses, which are due to substance misuse. Young males are more likely to die from each leading cause of death than females. And mortality rates are highest among American Indian, Alaskan Native, and black males. So you have a lot of referrals. You want to make sure when you get into your practice what the resources are, because you're going to need a lot of help for those who are, have substance misuse, are also are using sex to get drugs, which you're going to see definitely see a lot of, and also mental illness and suicide attempts oftentimes are sprinkled with substance abuse and sexual promiscuity. Negative peer influences, you want to prevent and reassure them that the peers, if you can see it, I understand that your friends mean a lot to you, but it sounds like your friends are not making good choices, and potentially if this adolescent has a goal, you can say that this might be impacted if you continue to hang around with your friends. And that would have to be maybe not the first visit. Again, the biggest thing is you're connecting with the adolescent. Emancipated minor laws. A person under the age of 18 can legally consent for his or her own medical care if he or she is married, widowed, or divorced, the parent of a child, a member of the armed forces, they're pregnant or believes herself to be pregnant, living separate apart from a parent or legal guardian, and is managing his or her own financial affairs. You won't see a lot of this, but you will see it. I have seen it in the emergency room where they have been separated and living apart independently, and the adolescent is homeless because the parent is not available. And a lot of times they come into the ER for services. And they are followed by a social worker most of the time because they need a lot more support. There's not a lot of 18-year-olds that are emancipated minors, but know that there are, and a lot of times these kids need a lot of support. Testicular torsion is also something that in adolescents, that in males, that we definitely want to make sure we don't miss. All scrotal pain considered torsion until proven otherwise. It affects 1 in 4,000 males younger than 25. Greater than 90% occur without any precipitating event. 4 to 8% are the result of trauma. Early diagnosis and intervention are essential to avoid testicular loss. Ischemia occurs in 4 to 24 hours after torsion. Greater the degree of rotation, more rapid onset of ischemia. Testicular torsion is a disorder in which the testes rotate, twist, and strangle the spermatic cord, cuts off blood supply to the testicles, and the spermatic cord consists of blood vessels, lymphatic vessels, nerves, and vas deferens. Testicular torsion, increase in testicular volume associated with puberty, testicular tumor, testicles with horizontal lie, history, cryptocortism, which is the undescended testicles. They're also at risk for testicular torsion, and spermatic cord with a long interscrotal portion. Signs and symptoms, if someone presented to you with this, this is an emergency. We'll do probably a bedside ultrasound and then call the surgeon to come in for something like this as soon as possible. Sudden severe testicular pain followed by diminishing pain after several hours. After necrosis begins to set in, you have swelling of one testicle, blood and semen, lower abdominal pain, lump in testicle, nausea and vomiting, and redness of the scrotum. Diagnosis is based on history and physical, Doppler ultrasound, radio, nuclear scan imaging might be needed with surgical exploration in the OR. Treatment, refer for emergency surgical consult. Surgical distortion or manual distortion is a treatment. And that's it for my adolescent lecture. If you have any questions or concerns, please let me know. A lot of the lecture is memorizing terms that you were required last year, and there'll be a couple of questions on the developmental stages of adolescence, especially Tanner.